Hi, everyone. My name is Gretchen. I'm a first year pulmonary and critical care fellow at Washington University in St. Louis, Missouri, and one of the CFRI's Patrick Nash Fellows of 2025. So today we're going to be talking about colon cancer screening in people with cystic fibrosis. So in the age of highly effective modulator therapy for many people with cystic fibrosis who qualify for this therapy, CF is changing or evolving from a disease of infancy and childhood into a chronic disease of adulthood, where people are living longer and they're facing different challenges than people with CF faced in the past before highly effective modulator therapy. Over 60% of people with CF are over 18 years old now, as according to the 2024 registry data set. And it's projected that over 70% of adults within the next decade will be in the CF population. So 70% of people with CF will be an adult, with a population of over 50,000 people in the US with cystic fibrosis. So it's our job now to kind of change our focus on how we can support people through aging with chronic diseases and also cancer screening. So what we do know is that people with cystic fibrosis are at increased risk of all cancers and specifically at a higher risk of colorectal cancer. So the median onset for someone with cystic fibrosis is 20 to 30 years earlier than someone who's at average risk in the general population. For example, someone who's has cystic fibrosis who's age 40 to 49 compares to someone's risk who has in the general population who's 65 to 69. And we have case reports of people having been diagnosed with colorectal cancer who have cystic fibrosis who are within their 20s, 30s, and even I've stumbled upon a case report of someone in their teens diagnosed with colorectal cancer, although that is very rare. It's been seen. In 2013, there was a cohort study released that looked at data from 1990 to 2009, which showed that there were people with cystic fibrosis were at a 6.2-fold increased risk for colon cancer within their lifetime. And that risk was even higher in people who had received a solid organ transplant, whether it be lungs or any solid organ in their lifetime. And it was also shown that people who were homozygous for the F508 delta mutation, which we know a lot of our population, that is the case for them, and people who had prior digestive complications, including chronic constipation, intestinal obstruction, were at higher risk to get colon cancer. And most people with cystic fibrosis were diagnosed with colorectal cancer prior to the age of 50, which is much different than the general population. So this prompted the thought from the Cystic Fibrosis Foundation and experts of we need to be screening our patient population differently than the general population because the screening will be too late. So why do people with CF have an increased risk of colorectal cancer? There's a few different hypotheses. There's not one reason that we have can say. One thing is inflammation, so chronic inflammation, altered gut microbiome from recurrent infections, antibiotics, is thought to increase the risk of the colorectal cancer. There's non-inflammatory reasons, such as there's increased cell turnover, nutritional deficiencies. People with cystic fibrosis, and as we know, their mucus is different, so that mucin lining the gut is different, and their bile acids are different, which could contribute potentially to the increased risk of colorectal cancer. There's also thought to be a big genetic component. So, in different models, such as mouse models, using intestinal specific CFTR knockout mice, so that means they took mice and basically took their CFTR genes out, they were more likely to have colon cancer, small intestinal cancer. And it's thought that not having the CFTR gene uh, promotes the likelihood that you may get a digestive cancer. And then additionally, people who have had a solid organ transplant are on immunosuppressive medications, meaning that they don't want their immune system to attack that transplanted organ. But what that also means is that your immune system can't attack abnormal precancerous cells. So people with transplant are at, who have had a solid organ transplant are at higher risk for all cancers, and specifically, it's been shown a much higher risk for colorectal cancer. So, knowing that, I think it's important for people with cystic fibrosis and the general population to know what the early signs and symptoms of colorectal cancer are so that people can feel empowered to discuss this with their providers, with their doctors. And this would include rectal bleeding being the biggest red flag symptom, specifically blood mixed in with your stool, abdominal pain, and unexplained iron deficiency anemia, meaning that your people will say like your blood levels are low or your hemoglobin is low. And if you haven't had that before, then it's a new symptom for you. That would be something to ask your doctor about. Unintentional weight loss, meaning that you weren't trying to lose weight, you haven't had a change in your diet or exercise habits, but you're losing weight. And that would prompt you to discuss maybe getting a colonoscopy sooner than the recommendations if you are having any of these early signs and symptoms. So now we'll talk about like what are the recommendations. So there's screening guidelines that have been established for the general population. People are average risk who don't have a family history or any genetic disorders that put them at a higher risk of colorectal cancer. So there's strong evidence that people should start screening at the age of 50, and in some expert opinions that general population should start screening at age 45 to 49. And for the general population, there's multiple screening abnormalities. You don't have to get a colonoscopy. There's imaging, there's stool samples that you can send in that you may have seen commercials for. Now, with people with cystic fibrosis, it's recommended to do earlier screening for the reasons that I discussed before, and then also more intensive screening. And I'll explain a little bit more what that means. And part of that is that colonoscopy is what's recommended. There's not sufficient evidence to support some of those other screening modalities that are available to the general population. So, really, you need a colonoscopy. So we had our screening guidelines that were put together in 2018 by 18 members of a committee, including professionals, which are physicians, providers, scientists. A parent was on that consensus guideline team as well, and a patient. They looked at a lot of the literature that was out there, including that study from 2013 that I mentioned that had compared people with cystic fibrosis from 1990 to 2009 to people without cystic fibrosis and their cancer risks. So they did a literature review, and then they also did modeling to look at what would be the cost benefit analysis for starting at different ages and using multiple models to try to come to a decision of what the screening recommendation should be with people with cystic fibrosis. So, if you have cystic fibrosis and you've never had a transplant of any type, then you should start screening at age 40, according to the CF Foundation's guidelines from 2018. And then repeat screening every 5 years if there's nothing abnormal on your colonoscopy. And then every 3 years if you have a polyp that's precancerous. This is different than the general population where you have a normal colonoscopy, then you can wait 10 years. And that's because people with cystic fibrosis are known to have been shown to have more aggressive colorectal cancer if they have it. So you want to check again in 5 years to make sure nothing has developed. And people with cystic fibrosis who have gotten a solid organ transplant, then they should start screening according to the guidelines at age 30 or within 2 years of the transplant, whichever's first. And then they have similar repeat screening follow-up recommendations. A little bit more about how to screen is, like I said, colonoscopy is what's recommended. There's not a good enough or robust enough evidence to support some of the other screening modalities that we have available. That being said, maybe there could be in the future. There's also important to note that there's an enhanced bowel prep required. So what that means is that you need to take extra medicine to clean out your bowels before getting a colonoscopy. Because when you get a colonoscopy, there's going to be a provider, a gastroenterologist typically, who will look with a camera on your colon in order to visualize if there's any precancers, polyps, or cancers. They have to be able to clearly see the lining of your intestine. And if there's a lot of stool in there, then they can't see that. And people with cystic fibrosis, as we know, have thicker mucus lining their gut. So they need more doses of the bowel prep or the laxatives before their colonoscopy. There's challenges that we've seen since 2018 when these guidelines were released. One of them is just getting people to get their colonoscopy and have it recommended to them, go complete it, and then have the correct follow-up recommendation. So according to the registry data, only 42.6, so then less than half of people who are eligible with cystic fibrosis got their screening, which is a huge gap. That's half the people who are eligible in the registry didn't get a colonoscopy when they could have qualified for it. It was slightly better in the population of people who had had a lung transplant, but still less than half. So that's a really big gap that we can have room to fill and improve upon. There was also higher rates of inadequate bowel preparation, meaning that even though they may have done the bowel cleanse to clean out their bowel, when the provider, the gastroenterologist, goes in and looks with the camera, they can't get a good view. And that means that you could be missing polyps. If you got a colonoscopy and they couldn't get a good view, they may not have seen a polyp that was there or a precancerous lesion. Another problem that we've seen is inaccurate follow-up recommendations at a single center QI study that I was a part of. We noticed that especially people who were getting their colonoscopies outside of the institution that their CF center was at may have had inaccurate follow-up recommendations. So they may have been told, okay, your colonoscopy was normal, you can get a repeat in 10 years, which with someone with cystic fibrosis, the recommendation is actually 5 years. Um, so that's something that we have room to improve upon as well. And people may not be able to get their colonoscopy at the same place that their CF center is at. If you live really far from your CF center, may be somewhere closer to get your colonoscopy. But if you're going to do that, you need to just make sure that the provider who's going to be performing the colonoscopy is familiar with the different screening guidelines, recommendations. And then there's ongoing discussion about what really is the best time to start screening for people with cystic fibrosis for colon cancer. As I said earlier, there are very young people before age 40 who are diagnosed with advanced disease, and there's many experts who feel that colon cancer screening should begin earlier. Um, so that is something that needs to be continued to be investigated upon. And then also people should feel empowered to think of those signs and symptoms that I mentioned earlier, especially if you're under 40 and you have one of those things, you may want to be more aggressive about pursuing a colonoscopy before that recommended age 40. And I think this will be an ongoing discussion for the future of what really is the best time to start colon cancer screening in people with cystic fibrosis. And then another challenge, and just that I'll mention, is that people with cystic fibrosis are at increased risk for other digestive cancers as well, although it was shown that the most common was the colorectal cancer. There was still increased risk for esophageal, small intestine, pancreatic cancer, and all other digestive cancers. And we don't have consistent screening recommendations or good modalities to do that yet. And so that's an evolving thing that people are looking into of, do we need to start screening for other types of cancers, and how can we do that effectively and safely? So I wanted to also mention resources for patients and providers. The Cystic Fibrosis Foundation has a really great page on colon cancer screening and recommendations. And then the CF Research Institute also has this as well, in addition to discussions about other types of cancers that people with cystic fibrosis might be at risk for. And I think this is important for one, if you're a provider caring for someone with cystic fibrosis, refamiliarizing yourself with their cancer guideline screening guidelines. And then if you're a patient or a person with cystic fibrosis, then being empowered to know what these guidelines are. And if someone's telling you to do something different, like, oh, you can get a colonoscopy in 10 years, or oh, you don't need that much bowel prep, you can just get the normal bowel prep, you can say, well, actually, this is what the guidelines are. And that it can we please do follow the guidelines. And it shouldn't all on the patient to facilitate that, but people should be empowered to speak up and have that information on hand so that they can say, like, this is what the guidelines are. And then it's our responsibility as doctors, providers, nurse practitioners, nurses to be aware that there's different guidelines for people with cystic fibrosis, and you don't necessarily have to have them memorized off the top of your head, but just knowing that they exist so that if you have a patient who has cystic fibrosis, you can look and pull those guidelines up. So I wanted to include my references, mostly registry data and some of those studies, and then also the guidelines. And that's all I've got. Thank you.